Good morning. My name is Chris Kilbright. I'm the superintendent here of the Ritenour School District. So happy that you've come back to the Ritenour School District to be with us again, to support us on our journey of serving every Ritenour student every day. It's my 12th year as the superintendent, my 25th year in the district, so I've been able to see the work that goes on and the partnership between the community and this district from a number of different seats. I started off as a 7th grade science teacher at Hake Middle School. That's where our health center is currently located, so I was a teacher there for 4 years. Moved into professional development in this building for a couple of years, worked with mentorship and mentoring new teachers. Moved into the assistant principalship at Kratz Elementary up by the airport, spent some time there, and then was the principal of Booter Elementary School, just south of Hake on the west side of the district, and then I'm completing my 12th year as superintendent. This is an amazing community. It's a life-changing space, and it's a place that's committed to serving the whole child, and we need our partners to support us in that journey, and that's why you all are just absolutely so critical in making sure that we're getting not only academic gains for every student, but we're meeting social emotional needs, we're meeting food insecurity needs, we're meeting health needs of students as well. Joined by a couple members of the team, just in case we get some additional visitors. So we've got Mark Brady and Mike Smith from our operations department. So we're prepared in case we get an even bigger turnout. This is a great turnout, by the way. Julie Hahn, Assistant Superintendent for Data and Student Supports, is here with us. You know Lisa Glover-Jones. Lisa also serves on our Board of Education. And then this whole event is being recorded. We have Jenna Gandolfo from our Community Services Department. She's also our webmaster here in the district. And we also have Dr. Denezla Dorsey, who is one of our social workers that serves students at Husky Academy. So thanks again for coming out to the Ritenour School District, and thanks for being partners with us on our journey. I will turn it over to Ms. Jewell.
Thank you for the warm welcome and for having us here today. Good morning, everyone. So glad to see you all. I'm so glad you're here with us. My name is Tish Jewell, and I serve as the Vice President of Ambulatory and Clinical Support Services at St. Louis Children's Hospital. And I have the pleasure of working with our various community health initiatives. I have some remarks today that I'm going to share to set the stage for our conversation. Looking forward to hearing from this amazing panel as well today. So I also want to say a thank you to our friends at Ritenour, because obviously this partnership would not be possible without you. Thank you for hosting us here today. We're very appreciative to be able to come in to the community and share our story. I also want to recognize 2 groups today, because without them, this would not be possible. Our school-based behavioral health program, without them, the school-based behavioral health program would not be possible. First and foremost, I want to thank our community health advocacy and outreach team. We have several members here today. They dedicate their life, their calling to this amazing work. I also want to thank our visionary donors. Without them, this wouldn't be possible either. They gave oxygen to this program, and they took a leap of faith on us to make this a reality. We're truly humbled by the partnership and truly thankful beyond my heart. I also want to introduce or share, if you will, a couple of reasons why we're gathered here today. One, I want to talk about the current sort of mental health crisis and how we got here. I also want to talk about how St. Louis Children's is responding to that crisis. It's very important. And not only responding within our 4 walls, but how we're partnering with communities to address the needs. Let's start with some statistics that unfortunately are pretty astounding. The number of children ages 3 to 17 who are diagnosed with anxiety or depression grew by 30% from 2016 to 2020. 30%. Approximately 2 million adolescents attempt suicide each year. 2 million. This makes it the 2nd leading cause of death for children ages 10 to 24. More deaths than any single disease. Think about that. Only second to unintentional injuries. And unfortunately, 20% of our high schoolers say that they think seriously about suicide. 20%. Children's hospitals across the country are experiencing an overwhelming demand for services. And we have few doctors and counselors that are really trained to be able to meet the needs, and even fewer facilities that can really support our patients with behavioral health needs. As a result, too often, problems go unidentified until they're really serious. And oftentimes, the care that they need, it takes a long time for them to receive services. Even with the best coverage, access is still a challenge. Mental and behavioral health continues to drive up our daily census at St. Louis Children's Hospital and continues to remain a priority for us as a leadership team. In 2021, we saw about 32 patients per day that had some sort of severe behavioral and mental health need. For reference, prior to the pandemic, it was 2 to 3 patients a day, right? Tenfold. Even today, as we start 2024, we're still seeing about 16 patients per day, so well above what we saw prior to the pandemic. We're also seeing very long lengths of stay, so patients that are with us for months, even a year plus. I'd like to share a story to kind of give you some context about this very situation. So we currently have a patient today that was brought in by his father. He was exhibiting increased aggression and unmanageable behaviors at home. The patient is a preteen. He has autism spectrum disorder and mild developmental delay. He requires medication adjustments, and due to his intellectual disability, he is not eligible for a safe, sort of structured environment on a typical behavioral health unit. His father unfortunately decided that the best thing for his son was to relinquish his duties as his parent. Think about that. So now he is in the custody of Missouri DCFS. He's going to need long-term placement, some type of residential facility. The patient has been with us since December, and we currently don't have any options today for him to safely discharge him. As a mom of a 16-year-old boy and a 5-year-old who was diagnosed with autism, this saddens me, right? That the father felt like this was the only option to really do what he thought was right for his son. And this is becoming more and more the norm. This is no longer an exception to the rule. So what are we doing about it? We've done a couple of things that I'm very thankful for. We've increased our staffing to support patients with behavioral health needs. We've also developed new care models and training to support our team members so they can better serve these patients. We're collaborating on the state level, both Missouri and Illinois. In Missouri, we're focused on a comprehensive array of services for our patients. So we're looking at hospitals, community health providers, federally qualified health centers, social services providers, and even working with the Department of Mental Health and Social Services. This is no small feat to bring all these organizations together to try to ensure that our patients have all the services that they need, but it is necessary. It is a must. In Illinois, thankfully, they've made some further strides, but there's still more work to do. So we've been focused lately on making sure that we have an easy way of identifying all the services that are available by supporting their new health portal. We're seeing some really promising results. Now, we recognize that while we work to create safe spaces, like a new 14-bed inpatient unit, or enhancing our ED so that the rooms that we can provide for these patients can keep them safe as well, we know that beds alone is not enough, right? It's not going to fully address the need. We know that we can not only be reactive to this crisis, but we must be proactive. That means we have to go beyond our 4 walls, right? We have to swim upstream and actually go out into the community and offer these services. So our goal was and remains to keep kids from ever reaching our doors. One of my favorite phrases is that if they've gotten there, we have failed them. We must do better. We must do better. Many families can't or won't seek out mental health services, so oftentimes it does fall on the schools to bring the care into their neighborhoods. Schools are asking, sometimes begging, for support to be able to address these real needs of their students. In 2020, our community health team leveraged those relationships that we had built with schools over the last 24 years, and this program sprang into action. Now we're able to bring experts into the schools to support the therapeutic needs of these students. This new program, like all of our programs, will help to remove barriers for children that receive these services without cost to families, without kids ever having to leave school, without parents having to take off work. This was no small feat either, but today, because of the hard work, dedication, and generosity of our donors and our professional team at St. Louis Children's Hospital, we have brought mental health care services to 30 schools. 30 schools all. We have served over 200 students, and we meet with them often weekly, whatever it is that meets their needs, and we know we're not going to stop there. We're going to continue to grow these programs because of the support that we receive from our donors and because of the invaluable partnerships we have within the community. Before I introduce this amazing panel, now that I've talked enough, we will actually hopefully play a little video, maybe. It talks a little bit more about the amazing community health programs that St. Louis Children's is able to offer.
A lot of times when people think of St. Louis Children's Hospital, they think of the standing building on Kings Highway. But what many people don't understand is that we are bringing medical care directly to over 10,000 kids in the community. When we look at the barriers that our families may face in the community, not everybody understands the significance or has access to getting to St. Louis Children's Hospital.
In low socioeconomic neighborhoods, what I've found is that healthcare isn't readily available. And so our parents really look to the schools.
The Healthy Kids Express is a pediatric outreach program. We have 4 large mobile RVs. One specifically is a comprehensive dental unit. One is a comprehensive asthma unit. Another one provides preventive screening. And then we are launching a diabetes mobile unit. With those mobile outreach vans, we are basically pulling it up at the school and bring the kids out onto the van to provide those medical care.
Kirsten Wilford. I work for St. Louis Children's Hospital. I'm actually a school nurse within Lexington Elementary, so I'm within St. Louis Public School, servicing the children of North St. Louis.
Those staff, they're actually staff and employees of St. Louis Children's Hospital who every day they report directly to that school to provide care at the school versus coming to the hospital or getting on the van to provide the care.
I wanted to find a role where that I can use my expertise or my degree within nursing and actually serve my community.
Kirsten does an excellent job in partnering with the families and really just meeting them where they are.
I built relationships with the families, with the students, with the staff, and that's big. In order to provide those services, a lot of these children, they don't have their basic needs met. We are here to provide you with everything that you need. I know within St. Louis Public Schools, they get a very small budget. When I first started, I think each nurse got about $150 every school year to actually spend that money on whatever they wanted in their office besides the basic needs that they would get. But coming from children's, honestly, the resources are endless. You have the opportunity to get the supplies that actually fit the needs of your schools.
Hodgin, our school nurse and behavioral health therapist, really communicate with parents and build a partnership to where we help our parents become an advocate for their child and for their own health. It breaks down those barriers of any mental health stigma or any insecurities that they might fear.
It's just literally world-class care within the community. We're bringing that St. Louis Children's Hospital care to North St. Louis, to Lexington Elementary, within all of the schools that we service.
We typically service about 80 schools per year. In total, we are serving over 14,000 children and youth. We're partnering with the schools to provide an environment where they focus on the whole child and not just on the child's education.
if they didn't have St. Louis Children's Hospital, those are needs that would never be fulfilled.
Maybe we are the only provider that they're seeing. Maybe they've never seen any other medical provider. We may be that first encounter. So we want to make sure that it's a welcoming, educating, and engaging process. So when the donors give those donations, all of that contributes to that education, the clinical components, and then also providing and connecting families to the necessary resources that they may need.
We're literally on the ground within the community, and we're here for you. I think one of the biggest things is within children's is always doing what's right for kids, and this is it.
Video, and it really just shows how we bring our vision and mission of doing what's right for kids to life. So I'm really proud of the team and the work we're able to do with the community and the partnerships that we have. Now with that, we're going to hear from this amazing panel today. So I'd like to take just a minute to introduce everyone. First, I'd like to welcome Dr. Dorsey, who is a licensed clinical social worker at Husky Academy.
Yes, thank you.
We also have Tana Clarity, who is our clinical supervisor of our Healthy Kids School-based behavioral health programs at St. Louis Children's Hospital. And we are so fortunate today to have Mackenzie Reed, who was a student at Hazelwood West High School, and her mom, Rachel Williams. So thankful to have you both here to share your story. Thank you. Let's give our panel a All right, so with that said, we're going to dive into some questions today. All right, so let's start with Tina and Dr. Dorsey. Would you please provide a bit of distinction between your two roles as you both support schools in somewhat similar ways, but definitely different as well? So.
Sure, I can go first. So for therapists, I'm a licensed professional counselor, and therapists adhere to the American Counseling Association Board of Ethics. For therapists, we are trained to work with and treat individuals with emotional, mental, and behavioral disorders. Just as social workers, we can work in a variety of populations as well as different settings as well.
So often when people ask, what is a social worker? What does a social worker do? A social worker is a professional that has multi-dimensional aspects of the community. So therefore they can work within the government, they can work within the hospitals, they can work within the schools, they can work within child services. And so as a social worker working within the school, I like to call us the first line of mental health, because we've been trained to identify by using the DSM-4 the same mental disorders or severe persistent mental illness that other therapists have. Also regarding to therapy or therapists, that is actually a cultural term that we've adopted. Therapists can be doctors, psychiatrists, nurses, anyone that sees a student or a person in a controlled clinical setting. And so that is what a therapist is and how we are different.
Thank you for sharing that. Very powerful. I love the fact too that you all are part of the prevention and early intervention strategies, right? Really trying to help kids before really their conditions or their needs exacerbate. Can you talk a little bit about some of the concerns and mental health needs of your students that you're helping to support?
Well, I would like to start back. Since the onset of COVID has actually pulled the Band-Aid off our mental health concerns. What we are seeing in the schools and what we are seeing in the community is that there is a high level of students that have anxiety-based disorder or trauma-related disorders such as PTSD. We're also seeing a lot of mood disorders such as depression, major depression disorder, dysthymia, all of those things, as well as students who are struggling with suicidal ideations and thoughts of that nature. Another thing that we are seeing with students is that we are seeing students that have those disorders but have never been diagnosed, have never seen. So they go through their school year being undiagnosed, which often we see in the classrooms. And so all of those things manifest themselves within a classroom setting.
Absolutely.
And I think, sure, to add to that, you know, post-pandemic, I think a lot of us saw just developed social skills and emotional regulation skills. And as we all saw, with just the increase of severity and prevalence of mental health challenges, there was a huge disruption in our educational system for children and adolescents. So it's just continuing to increase with the challenges that Dr. Dorsey and I see.
Yeah. And as a mom of a teenager, I'm sure social media and the other pressures are not helping, right? And being able to have the right resources to navigate all that is really important.
And as you talk about social media, at the rise of 1997, I don't know if some of you guys remember, at the introduction of social media, we saw anxiety go up. We saw anxiety go up in teenagers, both girls and boys, where they began to develop the comparison. And so a lot of anxiety dealing with their inner self, inner critic, how they look based on the likes and based on the things that they are exposed to on social media.
Really important point. So tell us a little bit about what therapy looks like, right? How do you provide support to the students in this setting from start to finish, and how do you help support them through their various goals?
So typically referrals come through Dr. Dorsey, school social workers, school counselors. Students can also self-refer, and in Mackenzie's case, her mom referred Mackenzie for services. So I got a chance to meet Mackenzie and her mom at a open enrollment at Hazelwood West High School where we were promoting our services. And so after talking to Rachel, we set up a phone intake, and I just gathered background information on the family, the reason for therapy, and then just started working with Mackenzie in October of 2022. And by the time Mackenzie achieved her goals, it was last summer, so June of 2023. And so right now, Mackenzie and I meet just on an as-needed basis just to check in with each other. So.
I love that. I love the fact that you can get referrals from multiple sources,
Yes.
including the individual students, right? No barriers, right? Make it easily accessible. All right. So talk a little bit more about maybe sort of the time you spend, Tana, and even Mackenzie, sort of in session. What are some of the things you like to focus on? What are some of the tools you might use to help provide support?
Mackenzie, would you like to?
I say, can you repeat the question one more time?
Yeah, tell me a little bit about what the sessions were like for you, right? What did you find meaningful and valuable?
Miss Tana, she's like really nice and understanding, so we really just talk about what's needed, what's going on through the week, what I really need to talk about, what I need help with. I really went to see her for my anger management and stuff like that, so if I was ever feeling like angry or stuff, we would talk about coping mechanisms and stuff like that, so she really just helped me through that journey.
Yeah, thank you for sharing. What about you, Tana? What was that experience like for you?
So I will add, when I first met Mackenzie and her mom, there was definitely some resistance to therapy, which is not uncommon, you know. Not uncommon, you know, to experience that. But I think what helped in those first few sessions with Mackenzie was just me asking about herself, figuring out who she is, asking you, you know, what is it that you want me to know about you? I think was one of the questions that I asked you. And that just kind of set the tone with our work moving forward.
How do you feel like Tana was able to help you?
I feel like since I was so resistant at first, it was really helpful that before she tried to just dive right in on what was wrong with me, she let me know a little bit about herself, let me feel comfortable with her. I was really resistant. But she just made me feel comfortable so that I could open up and listen.
Thank you for sharing your story.
Yeah.
Dr. Dorsey, why did you agree to this partnership? You know, why did you find it valuable for us to come together in this way?
Well, first, our district here at the Ritenour School District, we believe in, as Dr. Kilbright said, supporting the everyday child, the whole child. And so a part of our initiative is social and emotional learning. And so at Husky Academy, it was very important because we are an alternative program. We are an alternative school. And so we see students who are from the 5th grade up until they are seniors. And so we wanted to make sure that those students had the resources that they needed when they returned back to their home schools. And so having therapeutic services in our school gives that resource, whereas a lot of students that come to our school has never seen a therapist, have never talked to a therapist. There's often stigma around mental health or just even speaking to someone about what's going on. And so when we established this partnership, we found and we saw that the results were being very beneficial to our students so that they could have that safe space to go. Also with that, these therapists that we work with Children's Hospital, they also continue with them. So it doesn't stop when they're at Husky Academy. They go with them back to their schools. And so if there's a crisis at home, they are able to access a mental health professional who's trained and skilled and who also has a rapport with them that can help them navigate through that.
Very powerful, very powerful. Love the being able to provide that continuous support.
Absolutely.
But that safe space, right? Really important. I think that came out in your conversation as well. We got to create those spaces where kids feel comfortable sharing and then getting the support that they need. So Tana and Dr. Dorsey, what do you think might be some of the outcomes if we don't continue to provide these needed services in schools?
I think one thing that comes to mind is, kids walking around with untreated mental health and just not feeling supported and those needs not being addressed. I think it not only impacts their development, but also their functioning at home, at school, and in our communities. And I think from the school system standpoint, I believe that there would be more disciplinary issues, more fights in the schools, which could lead to suspensions, expulsion. To take it a step further, school failure, continued behavioral issues, and unfortunately, potential contact with the criminal justice system as well.
Yeah, she's exactly right. As we are seeing, it will be a global crisis. One of the things that we will also see I don't know if any of you remember, but when the mental hospitals began to close, a lot of people were on the street. And when they were on the street, we saw a rise in crime and criminalization. And so with our students, we would see those same things. Right now, we're in a mental health crisis. And so we will see all of those things that she indicated, such as more suspensions, higher student dropout rates. We will see people being unmedicated and all of those things that lead to just a global pandemic on society.
Yeah, I do not disagree. We're definitely at that point, right, where we're seeing this crisis exacerbating without support that you all are able to provide. Unfortunately, it would get worse, right? All right, so hopefully a little bit more positive, uplifting question next. If sky was the limit, what else could we do to better address mental health in schools? Sky was the limit.
If the sky was the limit, and I've said this before, if the sky was the limit, we would have a interdisciplinary factor in the schools, meaning that we will have nurses within the schools, we will have doctors within the schools, we will have access to clothing, food, instead of going to a food bank, having all of those systems within the school setting where you can go from a building to get those resources. Because again, transportation sometimes is a major issue for individuals where it might be there, but they don't have access to that place. Yeah. So having a marketplace, as we would call it, that meets the student and the families. but I can say we're working on that here at Ritenour.
I love it. I love it. I love it. So my next question, I love it. It reminds me of the Center of Excellence concepts where you really sort of wrap all the needed
Absolutely.
services around the individual, and this would be wrapping those
Yeah.
services around
Wrap
the
around
students,
services,
families,
that's
and
exactly
students.
what it's called.
I love it. I love it. What about you, Tina?
I think that's perfect.
Okay.
More wraparound services, easier access, yeah, just to eliminate those barriers for children, adolescents, and families.
I love it. I love it. All right, we'll start with you, Tina. What was your proudest moment in this program?
I have a couple.
Okay.
So when I first started with Children's, I was a therapist on the team that I now supervise. So just getting to see how much our program has grown and just the access that we have been able to administer, or, help students within all of these schools throughout the past 4 years, almost 4. So that's been a very, very proud moment, and getting to work with kids from all different types of backgrounds, Mackenzie as well. So yeah, I've just been very proud to be a part of it.
Could you ask that question?
Yeah, what's been one of your proudest moments partnering with us on this program?
The proudest moment is that students are able to have their own individual therapists. They're having to have that access to them. So that is very good.
Yeah, Mackenzie, anything you would share?
No, I say my proudest moment would probably be really like, I don't have to be so angry all the time. Because anger management was, like I said, what I really went to go see Miss Tina for. And she just helped me calm down and I didn't have to always be so hot-headed.
You have a beautiful personality. All right, I think we may have time for 1 or 2 questions from the group, so it's your chance to participate. Anyone have a question for us? Anyone on the panel? Or for a member of Children's Hospital?
Hi, thank you for this morning. So Tina, I wanted to ask if you could explain, because that this is a virtual-based program, and it was such a natural shift. We heard COVID, right? And I think that's such an important component of this. And then how do you, and the second part, has it changed to hybrid at all? Are there any therapists that do in person at the school?
Sure. So within our department, actually, there are 2 therapist teams. So I also am interim supervisor for our embedded therapist team. So for the virtual therapists, it's strictly virtual. And for the embedded therapist team, they are in the schools providing therapy services to students.
Yeah.
100%.
Yes.
Yeah, so we started with the embedded program, which has been very well received, but it also has some limitations, right? Especially in terms of the reach. And so we were able to expand to a virtual option, and we're currently really seeing really good benefits of both structures, right? It just depends on what works best for that school district. But yeah, so we've been very fortunate to be able to offer both options to our schools. Good question.
Yeah.
So mine's from Mackenzie. Sorry, girl. What would you say to the other students that would encourage them to reach out, like your mom did for you? And also, what could the staff do to encourage the students to use this service too?
I would say for the student that therapy, since I was really resistant, I was like, therapy, no, that's not for me. But then I started talking to Miss Tina, and it was really nice. I would just say, be open-minded. Don't be so closed off, because there's really nothing bad about it. You're just helping yourself. And as for teachers, I feel like sometimes it can be embarrassing if you just broadcast it in front of everybody, but maybe just like give the option to the whole class. Don't like single anybody out. Just, put it out there, and if they want to do it, I feel like they would do it.
Good question, great perspective. One more.
Yes, I have one for Mackenzie too. So it's so nice to have a student on the panel. So thank you for doing this today. So thinking about the question that was posed about like the sky is the limit from a student standpoint, what do you think would be an amazing thing to offer if there was like no barriers, no, resource barriers, anything like that?
I definitely think that, I know we have therapists in the schools, but like, Miss Hannah's amazing. Everybody needs a Miss
We're gonna start our cloning program.
But I definitely think that there should be like, I don't know, I feel like adults can sometimes think that what children see as problems aren't really problems. And I feel like if we have more people that, open up and like just with the open mind as well, with adults as open minds, I just feel like it would be easier to talk with adults like that. So, yeah.
Thank you.
With that, please let's give this panel another round of applause. Such amazing work by amazing individuals, and so appreciative of Mackenzie and her mom for sharing their story. With that, I believe I'm going to turn it over to Margot, who has a few words for us before we wrap up today.
Thank you, everyone. Well, thank you, as Tish just echoed, thank you so much to the panel for providing such an insider perspective on how our school-based programs make an impact and truly how they're thriving in the community. My name is Stephanie Hoppe. I'm a director at St. Louis Children's Hospital Foundation and one of the partners who gets the incredible honor of working with our community health team. I was truly inspired listening today to the testimonies, the stories, and Mackenzie, I especially want to thank you because I know how hard it is to kind of be vulnerable in front of a large group of people that you don't know. So thank you for being here. Thank you to Rachel, Mackenzie's mom, for being here to support her because we know that without that family support, things like this wouldn't happen, and we know not all students have that. So thank you all for being here. We know this work is extraordinarily important and it would not happen without you, but we also know the work doesn't stop here. St. Louis Children's Hospital is not slowing down and we will continue to increase the number of students we work with. But more importantly, we're committed to sustaining this program and growing strategically for ongoing impacts. We won't stop delivering on our promise, and we anticipate the need for delivering therapy services will be more than over $1 million annually by next year. And our closest friends and community partners are really the ones who made this vision a reality, and it's those community partners who will continue to make this possible. At this time, I would like to introduce you to one of those community partners who stepped up early and boldly with a lead gift, allowing our team to launch the school-based behavioral health program, specifically on the virtual side. So please join me in welcoming Ray Yancey, the Executive Director of the Dana Brown Charitable Trust.
Thank you. Well, thanks for coming this morning. This is such a great turnout. Good job to support this program. I have my notes just in case I forget something because it's so important. First, I'm Ray Yancey, Executive Director, but I've only been the Executive Director for 18 months, so I really can't take credit for how we started with this program. I'm the second Executive Director. The very first one, his name is the late Daniel Watt, and he was amazing. And he, along with the Dana Brown Charitable Trust Committee, awarded this grant in the fall of 2021. And yes, we were early adopters. There's no doubt about it. It was a big gift for us, for Dana Brown. It was a multi-year gift, so that we made a commitment to tie up a percentage of our allocation to the community to this group because we so firmly believed in it. And when I say that, Dan Watt was very passionate about this program because as we heard, the pandemic, COVID, because of his belief that children, students' mental health was so impacted by the isolation and the shutdown across the country, and especially we always bring things back in Dana Brown to our community. This is our home in St. Louis, that he pushed very hard for this grant. And it was his very last grant cycle before he retired, and he was we lost him tragically and suddenly. He was supposed to be here with me. It would be such an honor if he was here and could hear this and hear what the program has done. And it wasn't hard for him to do because I'm sure that what drove him, what pushed him to make this kind of gift, which was a little out of character for how we allocate, is that he, the strong community partner, he believed in it. He knew that St. Louis Children's Hospital would deliver on this project. He knew the approach, and he knew the expertise that they would bring. So it was an easy jump for him, but it was still a jump, right? For me, in 18 months and in the seat, and I had a lot of opinions and thought I knew a lot about what we were doing and how we were doing it. But this type of meeting and what hearing from it, thank you, Mackenzie. And just the panel, thank you for being here and being so vulnerable. It was amazing. I'm a bit of a nerd. We heard a lot of numbers today. I love the numbers. I love the story they tell us because it does tell us a picture if you just tease out those figures. You know, the brochure, it has it clearly. When we started the program as a pilot, 23 students. And you think about it, that seems pretty small for a big grant. That's what it started at, but 23 students who desperately needed that help. So we helped them, we helped their families, we helped the community, we helped their classroom, their teachers, their school. So that 23, that's pretty amazing. We could stop there, but 2 years later, it's over 180, right? 180, I think 183. That if we like numbers, that's a 700% increase. That's incredible. Something that I'm so proud of and just love that story shows that we're continuing. And Children's is continuing to deliver on exactly what they promised Dana Brown. The numbers, I think it was so interesting what you said about being resistant. What research, the other research that for the students who participated in the program, 98% of them, the ones who did take the time to fill out the survey, probably with their moms or their provider, 98% of them said that they had positive feelings about this program and it impacted their decisions going forward. That, what's a positive feeling? What that is and why it's so important is exactly what we talked about. It takes and breaks those barriers, the stigma of getting help. Not everybody has the resources or the tools to do what they need to do, and life happens or things happen and you can't control your anger or things just aren't working out the way. And that early intervention and the fact that we can do that and we have that for children, we know that it works. We know that will help us later on. Back to the numbers. There's a national survey that says that for every dollar that we spend for early mental health intervention, we save $10 later on in health. And also, in that low productivity, and that's, again, one of those nebulous little words, but productivity, how you interact with the people in your family, with your community, in your job, at school, in college. What we're doing, and I believe what we're doing is we're giving them tools to use and the power to access help when what they're doing isn't working. Right? So the numbers are incredible. The last thing I have to say, this is not a fix. This was not a fix at all. I promise him that. When I got the invite to this event, I'm like, well, yes, I'm going. This is Ritenour. This is my home. This is like coming home for me. I grew up not far from here. Had a very large, fragmented, very fragile family system, and there were many of I had a lot of wraparound services. My whole family did, and what that meant is that for me to be standing here today is that many of the organizations that Dana Brown funds for children and financially disadvantaged children are the programs that I had benefit. They were part of my life. So that was important, and it did impact my decision making, my goals, my anger, and what that resulted in. I was the very first girl, woman, child to graduate from high school, female to graduate from high school. Then you can just imagine I'm the very first person to graduate from college, and that impact. But that didn't happen because I was so smart. It happened because I had a great team that helped me. And then I had great teachers, I had great mentors, I had great coaches. And that is here, Ritenour. I graduated from Ritenour. I'm a Husky forever. Class of 78. And that was, again, not a fix. When Margot called, I'm like, and I told you, Mackenzie, we all get nervous up here, right? But this was an important message. So thank you for being here. Thank you for Dana Brown is very proud, Charitable Trust is very proud of this grant. It's a great grant, it's a perfect grant for us. I like to think that it's what Dana Brown envisioned. You know, he created the trust over 30 years ago before he passed. And his goal, what he wanted to do is create legacy so that we could allocate funds to organizations that would help children lead more productive, successful, healthier lives. And I just know that he's smiling now. So thanks for coming and celebrating. Thanks for allowing me to.